Hi, I'm Dr. Nancy Humber. I'm a family physician working in Lillooet for the past 27 years. I live and work in the northern Xaxli'p lands, specifically the lands of the First Nations community of Sekw'el'was, Xaxli'p, Xwisten, Cayoose, Creek, and Shalath. As an uninvited settler, I'm grateful for their historic and ongoing stewardship of these lands. Looking around every day, I'm reminded of the ancestors, leaders, matriarchs, creatures big and small, who once lived among these natural resources and cultural teaching from time immemorial, long before Lillooet District Hospital and the community of Lillooet existed. Before we begin today, let us take a moment to reflect on where we each are in our individual and collective journeys to improve our cultural understanding and more deeply reflect on the ongoing impacts of colonization on Indigenous people. I find reflections like this are an important part of cultural humility, and it helps ground me in my daily work to eliminate the impacts of colonization and to become a better ally with Indigenous people and a better citizen. When I first came to Lillooet, I came fresh out of medical school. I was trained as a GP surgeon. I came to Lillooet sight unseen and worked as a solo practice GP surgeon, an emergency room doctor, delivering babies, working in the clinic, and working in the hospital for 27 years. What was surprising to me when I first came here, nobody had told me anything about Indigenous people. I knew that they lived here, but I didn't know how to deliver care. I didn't know about the Tsal'alh Nation. I didn't understand anything about language, about culture, traditions, any of the traditional healing. Working in the hospital, you were completely isolated from all of that. So my cultural journey really took 27 years, which I continue today. It started with asking questions like, where does everybody live? What is it like to live on community? Who are the workers, the healthcare workers that work in community? What is important to the people? It also began with forming relationships, knowing elders, meeting the health directors, understanding who else was delivering care in the community. And all those things took time, commitment, and ongoing relationship building. Sometimes this journey is difficult. I have had moments where it's been very difficult. I've had moments where I go home and I feel fragile as a white person. I feel that I have spent years dedicating my career and parts of my life to providing care here. And I feel that sometimes it's really difficult to understand what it's like to exist and to work on Indigenous lands and still feel comfortable. And part of the journey is understanding where that comfort is. And the deeper your knowledge is and the deeper your reflection, the easier it is to move forward. And just because it's hard doesn't mean it can't be done. Sometimes what I've done is I try to incorporate a two-eyed seeing approach. Through a Mi'kmaq elder, this two-eyed seeing approach celebrates the strength of Indigenous wisdom and the strength of Western culture. And it tries to integrate both. And sometimes when I can't reconcile one and the other, I try to separate them out and look at, this is where the strength of the Indigenous wisdom and guidance is, this is where my comfort is in the Western background, and try to find a way to reconcile that, knowing that a two-eyed seeing approach is broader and stronger together. I feel like the more we use this two-eyed seeing approach, the more we can understand and integrate Indigenous wisdom, teaching, and guidance into health. In order to do this, we need to become better allies. We need to elevate the voices of our Indigenous partners. We need to clear a space for them to step in. Not everybody can articulate and express their wishes at the drop of a hat. Some people need time and space to reflect. We need to be helpful and understanding. And we need to pass the mic so that Indigenous people can speak on behalf of their own people and advocate for what they need. We need to ensure that decisions around health of Indigenous people are made by them. Make sure that all the right people are at the meeting. Maybe you're not the one who needs to be there. And that true partnership in Indigenous health is their leaders guiding and leading us along the way to better health. So yes, sometimes it's uncomfortable, and that's normal. It takes courage to do this work. It takes courage to examine our own bias and reflect on our own actions, both today and also decades ago. We need to do this individually on our own journey as well as collectively. But it's our duty to reflect and to do better. It's our responsibility. Although sometimes it's easier to say you do nothing, but doing nothing is not an option anymore. Breaking down barriers one step at a time to move forward individually and collectively to ensure the Indigenous experience of care in our health system is our responsibility. So, how can you start? Or how can you keep going? First of all, to remember that physicians' role in the hospital is powerful and our sphere of influence is broad. And acknowledge that sometimes that's really helpful because you can do good work and make it better. But also to understand and respect that sometimes it's not. And sometimes breaking down that hierarchy is actually the best thing that you can do at that moment. Next, acknowledge the land. Acknowledge it every day when you come to work. And write your own land acknowledgement. Take some time, go outside, look around. Think of what the land was like before the hospital was there, before you arrived, before any of the community was there. Get to know the people. Understand that looking after people, looking after Indigenous people means you need to understand at least a little bit about the language, about the culture. Take some time, understand that. And also, be easy on yourself. It's a lifelong journey. It isn't sort of 0 to 60. It is whatever path, whatever speed you feel comfortable with, as long as it's forward. And I think as physicians, maybe to broaden our view of what quality and safety really is, and understand that just as much harm can come from psychological harm as from physical harm. And it doesn't show up well on a graph or on numbers, but its effect is long-lasting. We have great examples of this. We have a whole report in plain sight that details all of the psychological harm and physical harm on Indigenous people. And when it gets messy, and when you're trying to figure out how do I sort of take all of this years of training and make people better and incorporate Indigenous wisdom into that, think of the two-eyed seeing approach, that having two eyes is better than one. And if it gets messy, take some time, take a break. But as long as it remains a commitment to continue to move forward. Kukshdem. Thank you.